BoomerLife.com/650.
Don't send me no doctor, filling me up with all of those pills. I got me a man named Dr. Feelgood. You know, yeah, that man takes care of all of my pains and my ills. His name is Dr. Feelgood in the morning. Taking care of business is really this man's game. And after one visit to Dr. Feelgood, you understand what Feelgood is his name. Oh, yeah. Oh, good God Almighty, the man show makes me feel real good.
Oh, yeah. Amen, sister. Aretha Franklin, Dr. Feelgood.
It's a great song.
You're smiling. That's all about you. That's what you do with your patients, Dr. Bobby Birdie. They come to see you. They're all grumpy, and then they leave and they feel good.
We like to hope. We like to think so. I think so.
You've been doing this for a while.
I have.
So when you were a little kid, let me take you way back, 5 or 10 years.
Sure.
Oh, by the way, happy birthday for yesterday again.
Thanks so much.
But when you were just a little guy, delivering papers, you're thinking to yourself, hey, I want to be a dentist.
Oh, you know what? I never thought that.
Really?
I never thought that. It's fun, kind of a funny story. I thought I'd either become a medical doctor or go into research or something, and then I just really liked working with my hands. I really liked the fact that in dentistry you get to do something, but I get to stay out of the hospital because I don't like hospitals personally, and it's a good setup. I really do enjoy what I do. So when I got into dental school, I didn't know much about it, to be honest with you, and then by the end of it, I'm a dual specialist. I went through 2 residencies. It's kind of the exact opposite of what I was when I first walked into dental school.
You're thinking to yourself, this is pretty cool.
Yeah, really cool.
Let me ask you another question, a little personal question, if you don't mind. I mean, you're a fairly big guy. How do you get those big hands of yours into people's little mouths?
Well, it's one of those things where you just get to use the tips, I guess. Really
I guess.
good. You know what? It's funny. You adapt like anything else, and you get really good at it, and it works out real well.
Interesting. Now, before the break, we were talking about who might be a good candidate for dental implants.
Sure.
What do you think?
Really, almost any and every one. In all honesty, anyone that's missing a single tooth, multiple tooth, or lots of teeth are going to be candidates for dental implants. People will say, "Well, I'm not a good candidate," or "I don't have the right amount of bone," and all those things. Well, those things really don't come into play very often anymore. Reason being is because we can grow bone, we can do grafts, we can do things to create bone no matter what, really most times. With a lot of the new materials out there, really, there are very few cases. And I've done cases where people have come in and there really is almost no bone. And we've been able to graft and get implants in their mouths, which is pretty amazing.
Now, would that be from disease or just because of age?
Age, disease, wearing dentures for 30 years, lots of things where really there isn't. I haven't had a patient yet that couldn't get an implant. Let's put it that way. There's also medical stuff that comes into play if someone's an uncontrolled diabetic, someone who smokes a lot, those kinds of things. What that ends up doing is making sure that what ends up happening is there's a bit more of an increased risk. But it doesn't mean they can't get implants. It's one of those things where, for instance, I have friends who are dentists, let's say in Mexico and other places, and they say to me, listen, if I didn't do dental surgery or implants on people that smoked, I wouldn't do work. I couldn't do it, right? So it's one of those things where, like I said, there isn't a lot of people, or there isn't really anyone that I've met yet that couldn't get a dental implant. It's just whether or not what the risks are involved with medical reasons. And, of course, with bone, we've got to have the right amount and the right quality. But we can do things to fix that all the time, absolutely.
Now, after our show, if somebody would like to go and learn some more about Dr. Bobby Birdie and his practice online, what is your website?
It's bcperio.ca. That's bcperio.ca.
We have 2 locations, Vancouver and Coquitlam.
That's right.
And the telephone number for Vancouver?
It is 604-872-0222. And Coquitlam is 604-936-8244.
Nicely done for a guy just had a birthday yesterday. That's pretty darn good.
Yeah.
For an old guy, you're doing okay.
I'm trying.
You're doing a great job. Nancy is on the phone. Nancy is another one of your patients, and Nancy is she's kind of a family affair, I guess, is what you would say.
She is. She ended up happening is, if I remember correctly, I think Nancy, it's her dad who's getting a lot of work done, and she's just kind of the one that's kind of referred him to the clinic.
Well, that's nice.
Yeah.
Yeah, our producer's going to get Nancy. Just called it. He's going to get her back on the line here. I think we just disrupted. You have Nancy on the phone? He's giving me.
Yeah.
It's like kind of hand signals.
Sure.
So we'll see. So if people are thinking again about dental implants, there's only one way to find out for sure, and that's to go visit Dr. Bobby Birdie. Consultations cost how much?
Zero. Yeah, all for listeners on the radio and for people that come in for implant consultations, all implant consultations are free.
And that includes the CT scan?
A lot of times, most times it does, yes.
And that is so much better than an X-ray?
It is so much better than an X-ray, and it saves someone a tremendous amount of money because the CT scan is pretty expensive most times.
And not only that, it saves them the going through a lot of radiation.
Yeah, radiation. Our CT scan machine in Vancouver is the lowest in the world right now, and it's 5 seconds, and it's paying less. It's great.
Always best to have the best here in Vancouver. Nancy's on the phone. Good morning, Nancy.
Yes, hi there. How are you?
I'm well. How are you?
Great, thank you.
Welcome to our show. I guess you and Dr. Bobby Birdie are old buddies now, huh?
Yeah. He, placed implants for my father. So my dad really wanted me to call in on his behalf, only because his English isn't greatest, so he's a little shy. But he had 7 implants and 2, 3 constructed on top of that on his upper, front face kind of deal. And he's so happy with the work and the results, and even just going through the process with him. I remember I took him, we went somewhere else first to get a quote and just an estimate and stuff. And it was just a bigger process there. I mean, it was going to take longer, and the estimates that we were getting were so different. So when we went to go see Dr. Birdie, it was literally 2 visits. And, even after the first time when he came home, you couldn't even tell that he had dental surgery, that he had, all this stuff placed in his mouth, and he was wearing these teeth. You couldn't even tell that they were just, not the real ones that he was going to end up with. So aesthetically, he looked really good, and he was pretty pain-free and went about his day, and then went back a couple of months, I think it was a month or so later, and got the final restoration done, and it looks beautiful.
Well, Nancy, earlier in the show, we were speaking to another patient of Dr. Bobby Birdie's. His name was Jason, and Jason was saying that after his consultation, the doctor sat him down and explained everything to him, the way the procedures would go in plain English. Did you find the same sort of thing?
We really did, yeah, and it was so clear. And then also they had this new technology, scans and pictures that they showed us, and it was so clear. Like, we were able to understand what he was going to be doing and what it was going to look like, the final product was going to look, and that was very different from another clinics that we had been to. Even my dad's dentist, they use all those dental terms, and then they kind of tell you, okay, this is going to go here, you really can't picture it. But with these scans and images that he showed us, you really could picture it, and you knew exactly what was happening, and so it's very impressive.
Totally amazing, isn't it?
It really is. It looks like a Transformers 3D.
Well, yeah, you're right.
Thing.
You go, does my mouth really look like that?
Yeah. So it was great.
So her dad was a good patient?
Her dad was an amazing patient, probably the best patient I've had in a long time. Is it okay, Nancy, if I talk a little bit about it? Is that okay?
Yeah, absolutely.
He came in, and he's one of those people that had a lot of his work done overseas. He had some work done in India, other parts of the world, and he came in, and all of his work, a lot of it had been done, and it all had to be kind of taken out and redone, a lot of it. And luckily, we got to save a lot of his teeth up top, but we ended up having to do a lot of crown and bridge on implants, and in the end, we got him a very aesthetic result. He's so happy with the way things look, and we took photos of everything along the way just to make sure that he's happy with everything, and it was a process that turned out very great. It was really good for him, and you could tell it's one of those times where you could tell on the day things went in, he's just so happy. It's amazing.
Nancy, if you have somebody else in your family, there's somebody listening to the program, they're thinking about maybe calling the good doctor here, what would you suggest they do? Just get on the phone, pick it up, and give them a call?
Oh, absolutely. You've got nothing to lose. One, when you go there, when he sits down with you, first of all, that consult, I was shocked it's free because so many doctors charge for that.
Oops.
But, so it just takes that ease off, like, oh, I'm going to pay so much for my x-rays. Because I know I got orthodontics. When I had to do that, I had to pay for every single visit, the consults and everything. I didn't even know if I was going to like the dentist that was going to do the ortho, or if he was going to give me the smile that I wanted, but I would still have to pay for that consult and stuff. So with Dr. Birdie's clinic, it was kind of like we have nothing to lose. If we don't like him, well, then we don't have to go see him. But it was nothing to like. There was nothing not to like. And, it was so good to talk to him. He was so knowledgeable, not pushy. And there's so many treatment options available, and he really wants, he would present to you something that's best for you rather than, what he thinks is, whatnot. So really, listens to your ideas and things, which was very nice.
Well, that's a great story, Nancy, and we're just about out of time for today, but maybe what we'll do is we'll get you back on the show coming up, and you can talk some more, okay?
Great. Thank you so much.
Fantastic. You keep smiling because you're looking good from where we can see you.
Thank you. Bye.
Thanks, Nancy. Enjoy your weekend. Wow. It's been an exciting hour.
It's been a great hour. I'm really glad people have called in and talked. It's pretty amazing.
So dental implants are probably good for just about anybody?
Yeah, almost anybody. I would say 99% of people. I would tell you a lot of times, let's put it this way, if those cases are difficult and you're thinking, well, they said I don't have a lot of bone, I'm not a good candidate, it won't work. There isn't a person I've met yet that isn't a good candidate.
All right. Well, you and I will get together soon in your office and again soon on the radio, and we'll just continue this conversation.
Absolutely.
Dr. Bobby Birdie, BCPerio.ca, Vancouver, and Coquitlam.
Right, that's right.
Quickly, the telephone numbers?
604-872-0222. That's in Vancouver. And then Coquitlam is 604-836. Oh, gosh, I forgot. 9244. There we go.
You can edit this part, so do it again. In Coquitlam?
In Coquitlam, it's 604-836-9244.
Fantastic. You enjoy your weekend, and hope you recuperate after the birthday yesterday.
I'm trying.
I'll see you soon, my friend.
Perfect. Thank you so much.
Thank you very much. Let's get out of here. It's Boomer Life with Tom Lucas, Dr. Bobby Birdie, and here's a song for the good doctor.
AM 650